Hello, this is Siri Kushner with the Olympic Community of Health, and this is the Intermediary Metrics Overview webinar. It's October 8th, 2019. The purpose of this webinar is to provide implementation partners with an introduction to the Olympic Community of Health Intermediary Metrics reporting templates and timeline. The intermediary metrics are one element of monitoring implementation partner progress on their change plan. The approved 2019 and proposed 2020 payment models, which will be reviewed by the Board of Directors on Monday, the 14th of October, include paper reporting on the intermediary metrics. For 2019, we have not had intermediary metrics. However, moving forward in 2020, today on this webinar, you'll learn more about our intermediary metrics reporting. Intermediary metrics are also part of the OCH Quality Improvement Strategy. The OCH earns pay for reporting funds from the Healthcare Authority for submission of a semi-annual report that includes our quality improvement strategy and narrative on such. Intermediary metrics are also one way to monitor progress toward the medication transformation performance measures. OCH earns pay for performance incentive funds for the Healthcare Authority based on progress on the MTP performance measures as outlined in the MTP project toolkit. Intermediary metric reporting and timeline, reporting and review timeline for 2020 and 2021 is as follows. Metrics will be reported in February. February will include only the required metrics. Over March and April, the OCH staff will review your submissions and report back in May and June. In August, partners will report again, the second reporting of the year, which will include both required and optional metrics if there are any for your partner type. OCH staff will review in September and October and report back to partners in November and December. This is the same timeline and process for 2020 and 2021. A summary of the intermediary metrics by change plan type. The different change plans are behavioral health, substance use disorder, community-based organizations and social services, hospital, primary care, and integrated physical health and behavioral health. If we look in the column shaded in gray, these are the number of required metrics by change plan type, ranging from 4 to 10. And in the optional column on the right in white, there are between 0 and 13 optional metrics depending on change plan partner type. Every partner organization will have their own reporting template. Some metrics are not applicable to some partners, so again, every partner will have a unique template. The required metrics, as I described, are reported 2 times per year in February and August, and the optional metrics are reported 1 time per year only in August. Reporting will be done in an Excel template. Partner-specific templates, as I described, will be released in January of 2020. And I'm now going to open the template so that we can walk through this together. The first tab of the Excel template is the Instructions tab. The reporting template has both locked and unlocked cells in it. You will only enter data into the unlocked cells, and those are the cells that are shaded in blue. The locked cells contain descriptive information about the measures. These are the locked cells. There is a cell that describes the national reference number. This could be for an NQS, NCQA, or HEDIS type measure, if applicable. There is a column J that describes the type of measure, whether it is required or optional. Column K has the master number for the measure. Your template may be missing numbers because not all measures are applicable to every partner organization. The measure description is in column L, which is the overall description of the measure. Column M is the calculation column. This is an important column. As you enter data into columns N and P, numerator and denominator, the calculation column will change to calculate a proportion or to show the numerator as input in column N. Column R is the measurement period, which shows the length, either an annual or a biannual measure. And column S tells you the specific date range for the current measurement period, which might be January 1st through December 31st for an annual measure, or January 1st through June 30th, or July 1st through December 31st for a biannual measure. The blue unlocked cells are those that you should enter data into, and they should not be left blank. If you do not have a value to enter, you should type the word not applicable or cannot report, depending on the reason for which you have no value. If you'd like to make a note about your entry, you can do so in column T, the notes column. This is a place where you can tell us information, background information related to your entry. Please note that if you use not applicable or cannot report, you must spell these correctly. It is not case sensitive, but you will get an error message if you do not spell them correctly. Depending on the measure, there might only be a numerator value required, which is column O. If it is a proportion measure, then you will have both column O and column Q be shaded blue, where you'll need to enter data into both cells. If you do not need to enter a denominator, then column Q will be shaded black. Of note, there are 3 metrics numbered 16, 17, and 37 that I will show you in a moment that are scale measures that require you to put in counts of 1, 2, 3, 4, and 5. And those are specific measures that have a drop down that I will now show to you. So this is the master measures template. It has all of the measures in it. And there's an example of a numerator value. There, when you click in the numerator or denominator cell, you will get a text box that tells you to please input a whole number or input the letters or the words not applicable or cannot report. If I try to type in not applicable, it works fine. If I make a spelling error, I will get an error that does not allow me to enter the information incorrectly, so I would need to fix that. Here's an example of a measure with a numerator and a denominator. I will zero these out to make them fresh. So if I put in my numerator value, you'll see in the calculation column that I now have a red shaded cell telling me that something is incorrect or incomplete. When I go to the denominator column, column Q, and I type in my denominator value, then the calculation column automatically calculates 27%. If I were to make an error and have a denominator that is smaller than my numerator, I would again have a red shaded cell indicating an error. This is an example, measures 16 and 17, of a scale. So this one is using a scale from 0 to 5. So they are described in column N, the numerator description column. So in these measures, you'll see that the text box that pops up when I click in the cell is please select all that apply, and I have an arrow button. If I click on the arrow, then I can click on any of the numbers that apply to my organization, and that is my value that now shows up in the calculation column. Another important note for hospital partners, in measures 11, 12, 13, 14, and 15, which are related to beneficiary visits by emergency severity index level, these 5 measures all use the same denominator, so you will only need to put the denominator in one time, and it will automatically populate into the other 4 cells so that the denominator is the same, the number of emergency department visits among Medicaid beneficiaries during the reporting period for all of the measures. And then you would go ahead and enter the numerator values for each of the different ESI levels, 1 through 5, in these cells here. Again, the partner-specific reporting templates will be released to partners sometime in January, and at the latest by January 31st, 2020. Partner reporting on the required metrics is due to the Olympic Community of Health by February 28, 2020. If you have technical assistance or other questions, please feel free to reach out to Phil Ramuno or to myself, Siri Kushner, and we would be happy to answer questions.